So CC-92480 is really an exciting new oral agent in the treatment of relapsed refractory myeloma. It belongs to what's described as the CELMoD class of drugs. These are very potent modulators of the cereblon E3 ligase complex, and in my opinion are quite distinct from the IMiDs, which obviously target the same broad structure, but unlike the IMiDs, 480 as I call it, is a very specifically designed molecule that engages the pocket broadly. It's a larger molecule, and its effects preclinically on degradation of ALOS and Ikaros are dramatic. So we call these degraders actually in another context, where they simply drive the degradation of these key transcription factors down dramatically. And this is a sort of switchboard in myeloma pathobiology. Not only affects directly on the myeloma, but also on the immune system. And I think that's an important thing to understand about the CELMoDs, that they are actually directly cytotoxic in a way that goes beyond what we traditionally think about for immunomodulatory drugs. So with that in mind, we have preliminary data from the combination of 480 plus dexamethasone in triple-class resistant disease, patients who've been very heavily pretreated, showing a response rate of around 55%, which is very encouraging, especially for an oral agent. Now, this particular study is a large trial with multiple cohorts looking at different combinations, and at the meeting we're presenting preliminary results from our cohort of patients receiving 480 dexamethasone and Bortezomib. Now, we report actually on approximately 20 patients with relapsed refractory disease. 100% of them were refractory to lenalidomide, almost half of them were refractory to pomalidomide, and importantly, almost all had received prior Bortezomib, and indeed almost a quarter had received prior Carfilzomib as well. So in that context, this was a heavily pretreated population, and we were very encouraged to see that when you combined 480 with Bortezomib in a dose-escalated fashion, number one, it proved tolerable, two, manageable side effects. The MTD was not in fact reached, so we landed exactly where we expected to be in terms of the dose and schedule, and most importantly in terms of the response rate overall, we saw that to be approximately 74%, which for such a heavily pretreated refractory population is very encouraging. Enrollment continues, and obviously we're continuing to enroll to the Carfilzomib cohort of 480 plus Carfilzomib, and there too the data are very promising.